Christopher is a single 57-year-old man who has smoked a pack of cigarettes a day for 17 years and has been a renovation specialist for 35 years.
The major function of the lungs is pulmonary ventilation, a mechanical process that depends on volume changes in the thoracic cavity to supply the body with oxygen and dispose of carbon dioxide. Air enters the lungs through the bronchi and branches into the bronchioles. The bronchioles eventually end at sac-like objects called alveoli, which are wrapped in blood vessels full of carbon dioxide. The carbon dioxide diffuses out of the blood vessel from high concentration to low into the lung, and oxygen diffuses into the blood vessels from high concentration to low. This process is known as gas exchange and is vital to sustaining human life.
Christopher has begun to notice he is short of breath when lifting heavy objects. He went to visit his doctor reporting feeling weak, experiencing chest pain, wheezing, and headache.
Common early side effects include chronic cough, shortness of breath, and wheezing. Other symptoms include blood and sputum, pain, hoarseness, difficulty swallowing, weakness, and fever. Lung cancers are aggressive, locally invasive, and widely metastatic tumors that arise from the epithelial lining of major bronchi. These tumors begin as small mucosal lesions that quickly grow. They can form masses that invade the bronchial mucosa or extend into surrounding lung tissue. Cancer cells have two main features. They rapidly reproduce, and there is a loss of differentiation. Cancer cells originate due to genetic mutations or exposure to carcinogens such as cigarette smoke or asbestos. Due to the masses in the bronchioles and surrounding lung tissue, airflow and gas exchange are impaired, causing wheezing. This blockage can also cause accumulation of bacteria, which can cause infections. The body's natural immune response will cause swelling in surrounding tissues, making it difficult to breathe. Due to the immune response, body temperature will also increase, and more energy is allocated to attacking the cancer cells, leading to weight loss and fatigue. Homeostasis is affected due to impaired gas exchange and the body's inability to properly ventilate the lungs. Enzymes, which are proteins, cause destruction of surrounding lung tissues, allowing for further replication and growth of cancer cells. And gas exchange occurs at the cell membrane and is impaired due to inadequate flow of oxygen and the cancer cells taking control of this life-sustaining resource.
Types of lung cancer include small cell lung cancers, which are highly malignant and have the strongest association with smoking. This type is rarely seen in someone who has not smoked. Non-small cell lung cancers include squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Squamous cell carcinoma is found most commonly in men and is strongly associated with smoking. It tends to spread centrally into major bronchi and higher lymph nodes, and patients with this type of lung cancer are at a higher risk for developing hypercalcemia. Adenocarcinoma is the most common type of lung cancer and is usually found in non-smoking women. This type originates in either the bronchiolar or alveolar tissues of the lung and may lead to scarring. It also has the poorest prognosis among the different types of lung cancer. Large cell carcinomas cannot be categorized as squamous cell carcinoma or adenocarcinoma and tend to occur in the periphery of the lung, invading subsegmental bronchi and large airways. They have a poor prognosis because of their tendency to spread to distant sites early in their course. Lung cancer is the leading cause of death among men and women in Canada and is the most preventable type of cancer. Cigarette smoking causes more than 8 out of 10 cases of lung cancer, with the remaining caused by factors such as exposure to asbestos or a family history of lung cancer.
Christopher would be considered at high risk for developing lung cancer due to his heavy smoking for 17 years and risk of exposure to asbestos when renovating older homes.
The diagnosis of lung cancer is based on a history, physical examination, and other tests, including chest x-rays, bronchoscopy, cytologic studies of the sputum or bronchial washings, percutaneous needle biopsy of the lung tissue, and scaling lymph node biopsy.
After a chest x-ray and percutaneous needle biopsy, Christopher was diagnosed with small cell lung cancer.
For all types of lung cancers, treatment may include surgery, radiation therapy, and/or chemotherapy.
After discussing treatment options with his physician, Christopher decided he will be receiving both radiation therapy and chemotherapy to treat his diagnosis of small cell lung cancer.
Created using Powtoon.